Thanks, Rob. Can everybody hear me okay? Is it too loud or too, just trying to make sure I'm speaking properly. Is good? Okay, thank you. So my name is Michael Gill. I own a company called Texas Senior Living Locators. For the past 10 years, I've been helping people find assisted living, independent living, and memory care. And as such, a lot of what I end up doing is education for people, because we've gotten into the industry and we're at a point where we use the term nursing home generically. And it's been segmented into lots of different parts. So we've got nursing homes, we've got assisted living, memory care, independent living. We now even have 55 plus apartments. And a lot of people just don't know what the differences are when they get to the time. And about 80% of the time I deal with the adult children of the seniors, and they don't really know where they fall in the industry. They don't know how they're going to pay for it, et cetera. So a lot of this education is something I do with families multiple times a week. So there's a lot that people just don't understand. And okay. And don't be surprised if there's a lot you don't know, because it's complicated and it's changing every day. Well, not quite every day, but it changes frequently. So let me see how I use this. Is that the first slide? Okay, well, let's talk first about the different long-term care options that we have. And so there's basically 4 different levels of care. I want to talk about the 4 different levels of care first, and let's start at the highest acuity. That would be a skilled nursing home. Now, a nursing home and a skilled nursing home are essentially the same thing. They're used interchangeably, and sometimes people will talk about a skilled nursing home as a SNF, which stands for Skilled Nursing Facility, SNF. A nursing home is where you go when you have for 3 different reasons. Number 1, if there's medical necessity. Medical necessity is when somebody is bedbound, when they have a tracheotomy, a ventilator, a feeding tube, catheters, or an IV drip. So that's the primary thing you need to think about for a nursing home, is that it's medical necessity. Okay? The other reasons that you go for a nursing home is when the government is the payer source. So any given nursing home has an average of about 58% of the people who are there on Medicaid. Another about 20% of the people who are there in a nursing home are there because they're on Medicare. That means that they're there for the very short-term rehabilitation stay, usually about 3 weeks. And for seniors, that's when they fall and break a hip, when they have a urinary tract infection, when they have pneumonia or something. The government goes ahead and pays for 3 weeks worth of physical rehabilitation, not because they're being nice, but because they realize it's cheaper to pay for physical rehabilitation before somebody goes back to the hospital, because a hospital costs $4,000 or $5,000 a night. It's only about $500 a night for rehabilitation. So if they can avoid another trip to the hospital, that's why they pay for short-term rehab. And then, so that's the reason. Those are the 3 reasons you end up going to a nursing home. The next level below a nursing home is an assisted living. And in the slide here, you'll see it says assisted living and memory care. So memory care is a type of assisted living, but it has an additional certification to have a lock on the front door. It requires more training than they have in assisted living, and they have about twice as many caregivers as an assisted living. So that's the difference between assisted living and memory care. Assisted living has caregivers as well. The level below assisted living is independent living. Independent living really means independent of caregivers and independent of regulations. So it's really assisted living light, and I want to sort of distinguish that from apartment buildings, because apartment buildings, a lot of people, at times I get calls for people looking for independent living thinking that we're talking about apartments. It's not apartments, because it has 3 meals as well, and so independent living, think about it in the terms of assisted living in the senior living industry. And then there's one other level that's popped up over the last 5 years. That's called a 55 plus apartment building. 55 plus apartment buildings basically don't have millennials, they don't have families with children, you have to be 55 or older to move in, or maybe your spouse is 55 or older. Generally, the 55 plus buildings are heavier on the amenities. They have a theater, they have a pool, they have a pub that you can go to where it's bring your own liquor, that they'll do things. But there's no regulations there. The only regulations for 55 plus, as is true also for independent living, is fair housing laws. So assisted living is regulated by Texas Department of Health and Human Services. It used to be DADS, which was Department of Aging Disability Services, but it's been rolled into Health and Human Services. And then skilled nursing is regulated by the Centers for Medicare and Medicaid Services. And that's relevant just because they end up having different personalities and different ways that they end up doing things. So, what are the payment options? Now, we're talking about how do you pay for long-term care? And let me just go ahead and go straight to the punchline. It's almost all private pay, except if you go into a skilled nursing home, in which case the only long-term care option that the government will pay for is Medicaid. I get calls all the time from people saying, gee, my mother has United Healthcare for Medicare, where do I put her in assisted living using United Healthcare? None of the Medicare does not pay for any long-term care. Medicare only pays for short-term rehabilitation services. So when they're paying for the short-term rehabilitation services, sometimes you'll hear that they pay for 100 days a year. Yes, they will, but only with medical necessity, and there's a copay for the second 80 days, and so we'll get into that. The point is that Medicare will pay for short-term, and there's a big deductible. So it's almost all private pay. Medicaid, I have a whole slide on that, and we're going to get into that. That is the only long-term care option. There are financial qualifications and there are medical qualifications, and we'll talk about that. And then we're going to talk about long-term care insurance also. So let's talk about the private pay options. That's the most common method that people pay for things. Assisted living, independent living, and memory care are 100% private pay in the Austin area. So what I mean by that is that their Medicaid will actually pay for a little bit of assisted living, some places outside of the Austin area, but it's so rare because Medicaid reimburses so little that nobody can make money doing it. So the last place closed down about 5 years ago that was in Austin, and there was one in San Marcos because they reimbursed so little they couldn't make money. Now, there is a place in Seguin that will take people on Medicaid. There used to be a place in Elgin, but I think they went out of business. But generally, the takeaway is assisted living, independent living, memory care, 100% private pay. Now, skilled nursing homes also have about 25% of their residents who are private pay. Skilled nursing homes generally cost over $6,000 a month and up. So skilled nursing homes are very expensive, and we'll get into that now. So let's talk about Medicaid for a second. As I said, the only long-term care option the government will pay for is on Medicaid. And there are a couple of different issues that you need to be aware of. Number one, to qualify for Medicaid, you have to have financial necessity. So in general, and by the way, all these slides will be available, and Rob will be sending them to you if you want them, so you don't have to take pictures, but if you'd like to, you're more than welcome to, certainly. So this slide gets a little bit complicated. And, so for an individual on the financial side, you can't have more than $2,000 of assets, and you can't have more than about $2,500 of income. So to qualify, that's the financial qualifications for an individual. For a couple, it gets a little bit more complicated. So what happens if you go on Medicaid? So Medicaid will only pay for a bed in a skilled nursing home. So what do you get? You get a shared room with 2 beds, 2 TVs, 2 chairs, and a sheet in between you and your neighbor. Okay? So Medicaid is not a very attractive option in a lot of cases, but it's better than the alternative. Okay? So there are a couple of things you need to know. For example, number one, you can't, to qualify for the financial requirements of having only $2,000, you can't just go ahead and gift your kids all your money or do something like that. That's called Medicaid fraud, quite frankly. And so there's a 5-year look-back period. So if any time in the last 5 years you sold your house to your son that was worth $400,000 and you sold it to him for $200,000, that's Medicaid fraud, and they would look at that. There's something called a divisor, and the divisor right now is $237. And so what that means is if you went ahead and, just for the sake of argument, to make it easy, if you gave your kids $23,000 a month, you divide that $23,000 by the Medicaid divisor of $237 a day, that means that comes out to an even 100. That means that you would not be able to qualify for Medicaid for 100 months, 100 days. So Medicaid would make you have that deductible if you gave that money away. Now, one of the things that happens too is if a spouse has to go on Medicaid, they don't want to impoverish the other spouse. So they allow the other spouse to have a certain amount of income. They allow the other spouse to have a certain amount of assets and to live in a house as long as the house isn't too expensive. So the additional income that the spouse can have would be $3,200 a month, as it says. Your house can't be worth more than $636,000 a month, and the spouse can't have more than about $137,000 in the bank. So they're not impoverishing the spouse, but you have to spend down to these levels. So what does it mean to spend down? That means you have to go ahead, if you had, $300,000 and you had to spend down to the $137,000, you'd have to spend all that money on health care expenses, on nothing else. A lot of this gets very complicated. I know enough about this to be dangerous, but generally what you're going to want to do is talk to a Medicaid expert when it comes time to figuring out how to pay for long-term care. There are ways to go ahead and, prior to the 5-year look-back period, go ahead and put assets into trusts and things like that to qualify for Medicaid down the line. Those are where you'd want to talk to somebody like Virginia Sampson, who spoke a little bit ago, because they know how to do that stuff legally. You don't want to do anything illegal because you can get in trouble yourself, obviously. But so talk to the Medicaid experts. If you want to go on Medicaid, how do you do it? Well, the answer is either you talk to a Medicaid expert who will help you qualify and make sure you have all the documentation filled out. That usually costs somewhere between $750 and $1,200, but it's worth every penny because they help you do it. Or you can go to your Veterans Affairs officer at the county. So Williamson County has a Veterans Affairs officer, so they also do in Travis County, and they will help you do some of this, I said Veterans Affairs, but also Social Security stuff. But also then if you want to go to on Social Security, you can go to any nursing home and talk to the admissions person, and the admissions person has the incentive to help you get heads in beds, so they want to help you with your paperwork as well. If you want to go on Medicaid, usually what will happen is that the family will have to pay for 1 month's rent up front, because the nursing home, you can imagine somebody's moved into a nursing home, they're promised, hey, I'll pay you as soon as Medicaid comes through, and then somebody moves out for some reason, they die, they don't qualify. Well, the nursing home doesn't want to get stuck with the bill, so they usually require the family put up 1 month's rent before they move in. That's when they're called Medicaid pending. And then once they've done that, they can move on to the community. That's the basics of Medicaid. I don't want to go into too much more of it because it can get so complicated. But the takeaway here is there are financial qualifications and there are medical qualifications too. And I think I have the medical qualifications. No, this is veterans benefits. So one other thing I need to mention on the Medicaid. I've talked about the financial qualifications. There's also medical qualifications. I would bet that 90% of the people on Medicaid are there because they have some degree of dementia. I have seen people in wheelchairs with multiple sclerosis who haven't been deemed sick enough to qualify for Medicaid. So when I see people who come to me and say, you know, my parents need Medicaid, I can't always go ahead and say, yeah, they certainly qualify. Usually though, they need to have mobility issues, they need to have some dementia, because if you have dementia, you're a danger to yourself because you may take your medicines wrong or something like that, or you may wander out. So that makes it pretty easy in general. But it's not a given that they're going to qualify from a medical perspective. So, paying for Medicaid, paying for assisted living. So one way that you can pay for assisted living is that there's something called veterans benefits. So the veterans benefits changed about 3 years ago. It used to be that there was no look-back period for veterans benefits. Now there are. So there's the program's called Veterans Aid and Attendance Benefits. It's a pension that you can get, and for the veteran, they can get about up to $2,050 per month. And for the spouse, they can get up to about $1,350 per month. So how do you get this money for assisted living? Well, the first answer is there's 3 qualifications. The first qualification is service dates. You have to have served during a time of war. Now, for the purposes of this, this is a political decision when the time of war existed. So, for example, World War II ended at the end of 1946. 18 months after the end of combat operations, but that's when Congress decided this benefit ends. We've got the dates up here for the Korean War, which went from, was it June 1950 to January 1955, and Vietnam went from 1964 to 1975. There's an exception here. If you were boots on the ground prior to 1964, you qualify. But for service requirements, you don't have to have been in country. You can have been in the United States working in the supply depot or something, or in basic training. And as long as you had 1 day of service during a time of war, you qualify. You also have to have had 90 days total service, active duty, and you also have to have been honorably discharged. Merchant Marines don't seem to count. Also, reserves don't count. It has to have been active service. Again, you don't have to have been overseas. You just have to during those times. The second requirements are financial. First, the thing is that you have to be spending more than your income on medical expenses. Assisted living is a medical expense. Memory care is a medical expense. Independent living is not a medical expense. Okay? So that's something to know. There are people receiving benefits in independent living from aid and attendance. That's kind of sketchy. They've been able to get it done, but don't count on it. Okay, so independent living is difficult. Second thing is there's now a limit on the amount of assets you have. It's about $137,000. If you have more than that of assets, other than your homestead, you have to spend down to below that $137,000 before you would qualify. And as I say, there's now a 3-year look-back period. Up until a couple of years ago, you may hear people say, oh, I just put my money in a trust and I was able to qualify. Up to about 3 years ago, you could do that. You would go to somebody like Virginia Sampson, who spoke here a little bit earlier. You'd say, I want an irrevocable trust. I'll go ahead and put, here's $500,000 I'll put in there. Now I qualify from the financial side. You can't do that anymore. So, because you would qualify the next day. Now there's a 3-year look-back period. So that 3-year look-back period has really taken a lot of people out of the benefits for long-term care, for veterans benefits. And as I said, get $2,050 for an individual and over $1,300 for a spouse if the veteran has died. And if both people qualify, you can actually get up about $2,500. I don't see that happen very often, though. Let's talk about long-term care insurance for a minute. So, unfortunately, long-term care insurance is relatively rare. Only about 4% of the people in any assisted living have long-term care insurance. The people I see generally are people who have been working for the federal government or the state government or for an education institution, because at some point when they signed up, there was a box you could check every year for the different disability benefits or long-term care benefits, and so they signed up for it. Other people who have it are usually people who are working with a financial planner, and the financial planner just said, hey, this would be a good way to save some of your inheritance for your kids. So it is relatively rare, is the first thing to understand. The second thing is you have to go out and search for it, and it has changed a lot over the years. And when I say it's changed a lot over the years, that's because the insurance companies lost a lot of money on it many years ago because people were living longer, they were having to pay out more benefits, and there used to be about 26 different companies that actually wrote long-term care insurance. I think there are really, these days, only about 4 companies that write long-term care insurance in general. And there even was a couple of companies that went out of business, and they went bankrupt. And Colonial Penn Insurance, for example, and I think they ended up having to go to the state insurance board to get their benefits, and people who should have had $300,000 or $400,000 worth of benefits were limited to whatever the state insurance board would reimburse, which was like $100,000 in one state and $300,000 in another state. So, at any rate, the next thing to understand about long-term care insurance is that every policy is different. There are no standardized rules about how the policy looks. So what they talk about is the 4 corners of the contract. All that matters is what's in the 4 corners of the contract. So you have to look at everything. Now, there are a couple of main points that you want to think about because there's a couple of terms. So for example, number 1 is the exclusion period. The exclusion period is basically your deductible. And that means that from the day that you qualify for your long-term insurance, and I'll talk about qualifications in a second, from the day you qualify to the day they start paying, that's the exclusion period. So most policies are anywhere between 30 days and up to 100 days. Some are 90 days or something. So that means that if you're paying $6,000 a month in an assisted living and you've got a 90-day exclusion period, that means after the first 3 months they'll start paying, but you're going to have to come up with $18,000, which is your deductible, before it starts kicking in. So that's the exclusion period. The second thing is, what's the daily reimbursement rate? I see a lot of policies where they have a $100 daily reimbursement rate because in the year 2001, when that policy went into effect, that was a good amount of money. Well, $3,000 a month, which is basically $100 a day, these days isn't going to cover much in the way of assisted living, because I'm going to get into the costs in a while, but $3,000 is about 65 to 70% of what an average assisted living will cost. Sometimes there is a rider in there for inflation. If you have an inflation rider, the policy costs about 50% more. So a lot of people didn't get the inflation rider because it's more expensive, but most people would wish that they had. And the reason is that the policy payout goes up by 5% per year. So if you had the inflation rider, that means about every, what's that going to be, 12 years, your policy would double. So after 12 years, if you had a $100 policy, that would be now a $200 per day policy. So anybody who's got an inflation rider, you're golden. That's a really good thing to have. Then there's the policy length. Originally, the policies written in the 90s and early 2000s, sometimes they were unlimited. So once you get benefits, you got them till you die. Nowadays, because what happened was that they thought more people were going to either die earlier or they were going to drop their policy or something along the way, their algorithm for how much they paid out was wrong, and they were paying out a lot more than they realized. So when they started writing new policies about 15 years ago, they went ahead and they started saying, okay, we're going to go ahead and limit this to 5 years or to 3 years. And so most of what I see in the new policies are 3 to 5 years. Occasionally you'll see something longer, but not often. And then there's the policy maximum. And usually the policy maximum would be something along the lines, okay, $100 a day times 365 days a year times 3 years, if that's the 3-year policy. That maximum equals about that amount. And that's, again, a way to limit the amount of payout that they have. Now, let's talk about the medical requirements. So for your policy to be kicked into effect, you're supposed to require help with 2 out of 6 activities of daily living. Now, activities of daily living is an industry term. It sounds like a very generic term, But there are 6 official activities of daily living for the purposes of veterans benefits and for the purposes of long-term care insurance. Activities of daily living are dressing, bathing. Third one is eating, and eating means getting the food from your plate to your mouth. It does not mean food preparation. So dressing, bathing, eating. The fourth one is transferring. So transferring means getting up from the bed to your walker or to your wheelchair or getting to the kitchen, etc. So a lot of people need help transferring, and so for example, the chairs you're sitting in now, they have no arms. Well, a lot of people need help getting out of chairs and they have to push with their arms, and some people wouldn't be able to get out of a chair like the ones you're sitting in. So they need help transferring, and so they need somebody to come and help them up just a little bit to lift out of the chair or something, or even more. But that's what transferring is. The fifth activity of daily living is toileting. Toileting means somebody may know, gee, I need to go to the bathroom, but by the time I can get up, get that far, they may have leaked on the way. Or they may have a hard time using the toilet paper or pulling their pants back up when they're on the toilet. That's where for people, they know they need to go to the bathroom, but there's just some logistical issues getting there and making it work. And that's different from the sixth activity of daily living, which is incontinence. And incontinence is where, gee, I didn't know I had to go to the bathroom, and look at this, my pants are wet, or something like that. So toileting and incontinence are different. Those are the 6 official activities of daily living. And the 7th activity of daily living that people should talk about and understand that people need help with is medication management. It's not an official activity of daily living. Don't ask me why, but it's just not. So to qualify for long-term care insurance and also to qualify for veterans benefits, you have to require help with 2 out of those 6 activities of daily living. The most common reasons I see people qualify would be for standby shower assistance, or for sometimes it's dressing, and sometimes it's the mobility issues surrounding transferring. But if you're not, so these are the reasons why people qualify. The last thing though, some of the newer policies also have you need 2 out of 6 activities of daily living, or you have to have severe cognitive impairment. So sometimes they give you the or for the dementia. But that's not existent in all the policies. So that's the basics of long-term care insurance. I hope some of you have it. Unfortunately, not enough do. Now, we talked a little bit about Medicare, but one of the things to realize, as I said before, Medicare does not pay for any long-term care. Medicare will pay for up to 100 days a year of rehabilitation if there's medical necessity, and I guess the average person spends about 36 days when they go into a nursing home. Usually 21 is what I guide clients to, is how much you're going to get. But what I want to talk about here from a financial viewpoint is the first 20 days are 100% paid for with no medical copay. The second 80 days, there is a copay, and the copay, I think it's about $185 a day. $185 is real money. That's about $5,500 a month. So, when you think that you have 100 days a year in a nursing home, yeah, but that's a pretty big deductible for the second 80 days. Medicare will also work for home rehabilitation services. So when you do go into a skilled nursing and you are discharged, they'll generally pay for another 2 days a week of rehab for about another 6 weeks with doctor's orders. That's just something to keep in mind. And the other thing about Medicare is that Medicare will pay for hospice 100%. And that's a really good benefit. I'm really proud that our system pays for hospice, because hospice is a wonderful service. Now, a lot of people are going to say, oh, hospice, that's only for the last little while. When we think about hospice, most of us think about cancer. And we think, okay, well, the last 2 or 3 weeks is when we want hospice. And that's not true for seniors. For seniors, in general, you're supposed to have a 6-month window of time when somebody's supposed to be living. And with seniors, it could be a couple weeks or it could be a couple years sometimes, because it's really hard to tell. So a lot of seniors will qualify for hospice, and when you think about hospice for seniors, I want you to think about it as a reimbursement scheme more than just, end of life. And the reason it's a reimbursement scheme is because they will pay for your diapers, they will pay for your medication copays, they'll pay for a nurse to come visit you once a week in person, they'll pay for a shower aide to come shower somebody 3 times a week in the house, they'll pay for a social worker and a pastor as well. So there's a lot of services that you get from hospice that you want to be aware of, and you also don't want to think of hospice as, oh, I'm giving up, I'm going to die next week. So this is something that's really good for, and hospice will come to you in assisted living, they'll come to you in memory care, and they'll come to you in your house. So keep hospice in mind and don't think of it as just the last gasp and something to be avoided at all costs. Now, how much does it cost for each level of care that we've gone over? Let's talk about that for a minute. So for a skilled nursing home these days, the average cost for a shared room, if you're paying privately, is about $200 a day, which is about $6,000 a month. Now that's for a shared room. For a private room, it generally costs about $275 a day, and that can go up to $500 a day at the most expensive places in town. So that could be $15,000 a month if you're paying privately. Memory care is a bit different. So and again, this is if you're paying privately. Memory care is averages in Austin about $4,500 a month for a shared room and about $5,500 for a private room. But the cheapest memory care is about $4,000, and the most expensive that I can spend in town is about $12,000. Memory care tends to be all-inclusive pricing, but it's complicated. Everybody's a little bit different. So what will happen some places is it's all-inclusive, except for you have to pay for the diapers, which makes sense because a diaper is a consumable item. But some places will also charge an extra $500 just because when somebody's incontinent, it's a lot of extra work keeping them clean. And then other places will be all-inclusive until you get to a 2-person transfer and you need extended care. And sometimes the extended care cost can be an extra $900. So when I give you these general rules of thumb of about $5,500 for a private room being a median cost of care, remember there's a lot of extras that can go in there. But it's less complicated than assisted living. When we get to assisted living rooms, that's always a base price plus extras for the levels of care. The extras for the levels of care, so the average person nationwide spends about $4,500 on assisted living. A private studio in assisted living may cost as cheap as what I have up here, about $2,500 a month. But then there's costs of care on top of that. A 1-bedroom apartment may go for anywhere between $4,500 and $5,500 a month, but again, there's cost of care. So everybody's got a different scheme for how they price their cost of care. In general, I'll tell you that the average person who's in assisted living that I see spends somewhere between $800 and $1,200 extra on cost of care, and the cost of care generally will cap out at about $2,000. And again, it's complicated because that generally may not include a Hoyer lift or a nebulizer or some other specialized type of treatments. But just for rules of thumb, say it's about $3,500 for a studio and about $4,500 to $5,000 for a 1-bedroom, and the care cost can add another $1,000 to $2,000 on top of that in assisted living. Independent living is a little bit different. So in independent living, that's where people go where they may have mild mobility problems, they may not, but they generally don't have too many cognitive problems, and they don't need that much extra help. But what the independent living community does is they'll usually rent an office to an outside caregiving agency, whether it's a Visiting Angels or a Home Instead or a Halcyon Home or Senior Minded Home Care, somebody like that. And usually when a home care agency wants to come to your house, they want about a 4-hour minimum. Because when they come to your house, they can't staff a house, staff having a caregiver go to more than 2 places in a day. because you can't run a business and have somebody trying to go to 8 places and make money that way. So if you have a 4-hour-a-day minimum, it's about $30 a day at home. That's about $120 a day for a caregiving agency to come to your house. But when they're in an independent living community, what they're doing is they're now just going from Mrs. Gonzalez's apartment in 212 to Mrs. Smith's apartment in 214 to 316, and they can charge by the quarter hour because there's no friction going from place to place to place. So in independent living, you can actually get assisted living light type of caregiving. But when you're talking about assisted living, independent living, you're now talking about just a base price, because independent living cannot hire caregivers. So back to pricing. A studio apartment will be as little as about $2,200 a month in independent living. A 1-bedroom apartment will be about as cheap as $2,500 a month, closer to $3,000 on average, or $3,500. What do you get for that, though? In all the different places, in skilled nursing, assisted living, and independent living, you get generally about 3 meals a day. You get some transportation to and from the doctor's offices, and your utilities are generally all paid for, okay? So usually you don't need all that much extra money once you're in an assisted living or in an independent living, because you're not paying for a lot of extra things. Most people, even in independent living, I'd say only about 20% of people in independent living keep their cars, for example. So there are other costs to keep in mind. Every place in the senior living industry charges what's called a community fee. A community fee is a move-in fee. It averages about $2,000 to $2,500 a month. It's one time. And usually you'll put down a deposit, and then you'll move in 30 days later, and that deposit becomes your community fee. Once you move in, that community fee is gone. Other fees are if you have a spouse, the spouse has to pay a second person fee. In independent living, the second person fee might be somewhere between $600 and $1,200 a month. That's usually for the extra meals and the extra services that you're providing. In assisted living, there's a second person fee for the meals, but then there's a second person fee if that second person has extra caregiving. So say you started in an assisted living in a 1-bedroom apartment with a spouse, you're paying $5,000 a month base price, and then one spouse, the wife needs $800 of extra care, the husband needs $1,200 of extra care, so now you're up to $7,000, and then there's a second person fee that might take it up to another $900, so that'd be $7,900. So that's how to keep in mind all the different costs that go on with assisted living and independent living. Medicaid, I already talked about a little bit. How do you apply? You either pay for somebody to help you with the forms, money well spent, somewhere between $750 and $1,250 for a Medicaid consultant, or you go to the admissions officer in a Medicaid facility and they'll help you figure it out. Veterans benefits, you can go to the county affairs officer, you can go to, usually the people that help with Medicaid also help with veterans benefits, and so you can get help there. And then long-term care insurance. Problem with long-term care insurance is usually you'd like to go back to your broker for help when you need the help, but usually that was 20 years ago and they've retired by now. So sometimes the service is not real great when you go to for long-term care, so that's all through private brokers. Now, just to tell you what goes on in Austin, there are about 55 skilled nursing facilities in the Travis, Hayes, and Williamson County area, or counties, and that's what I call the greater Austin area. And they average about 118 beds per community. The large assisted livings, there's about 55 of them. They average about 63 apartments per community. The memory cares, there are 64 of them by my count, and they only average 34 beds. One thing that ends up happening is there are more shared rooms in memory care than there are in assisted living. And there are really no shared apartments in independent living. Independent living, we have about 31 of them in the 3-county area. They are much bigger. They average 159 apartments overall. The 55 plus has been the fastest growing segment. The first one showed up in 2015, and I think next year I've got 4 of them that I'm following that are going to open up next year. So the 55 plus is really a growing area. That's the basics of what I want to talk about. It's unfortunate that senior living is so expensive, but that's just the nature of the beast. I hope this has been informative, and I'm willing to take questions.
We got about 10 minutes, so I am coming to you with the microphone. Yes, ma'am.
Could you talk about the CCCs, the continuing care communities?
Continuing care retirement communities are interesting. So what is a CCRC, Continuing Care Retirement Community, CCRC? That is a place that has all 4 levels of care on the same campus. Skilled nursing, memory care, assisted living, and independent living. We have 5 of them in the Austin area. The 2 of them are nonprofits, Buckner Villas and Wesleyan up in Georgetown. Those are nonprofits. Those are not buy-in communities. There are 3 other ones that are buy-in communities. That's Westminster, which is just off Mopac, across from Camp Mayberry, where the airplanes are. There's Longhorn Village, which is out by the Lake Travis Dam. And then there is Querencia, which is out by Barton Creek Country Club in southwest Austin. The CCRCs are sort of a different breed because most of them are buy-in. So it might cost $400,000 to buy in for a 1-bedroom apartment. Wow. But you get 90% of that back, or your heirs do when you die, when you move out. And the reason why it's expensive, what they do is with the 10% they don't give you back, so that'd be like if it's a $400,000 apartment, and by the way, it goes up to $1 million too. With the $400,000 apartment, they would keep $80,000, not give it back to you, and the $320,000 would go to your heirs or whenever you move out. I said 80%, it's 90%. At any rate, with the 10% they don't give you back, they kind of buy a long-term care insurance policy on you. And then when you move from independent living to assisted living to memory care, your price basically doesn't go up, which is a really good deal because most of us are living on fixed income at that point, and so you kind of are able to figure out what your expenses are going to be through end of life. That's a life care community. And so then with the amount of money that they're keeping until you move out, the 90%, they're paying down their mortgage. But then they're passing that on to you, that savings. So in a really upscale community, an assisted living apartment might, an independent living apartment might cost $6,000 a month for 1-bedroom apartment. They're going to charge you about $3,500. So you kind of there's a break-even point where you make that about 3 years, where that 10% that you're not getting back, you sort of make in savings from a monthly operating perspective. It's kind of complicated. Not many people want to go into it. I'd love to talk to you more about that afterwards, if you don't mind, because it's already pretty complicated.
I see your hand, and I am coming down to you.
Thank you. On the aid and attendance benefits, did they not extend the active service date to include the war and terror, Iraq, Afghanistan? It's Korea or Vietnam's the last. Is that correct?
They haven't done that yet because the veterans that were in those wars pretty much haven't gotten to the age they need it. But presumably the 1991 Iraq War will become one of those service dates, presumably.
In the beginning, you talked about spending down. So if somebody has some stock, instead of gifting that to an heir or giving it to a child, they should actually liquidate it and spend the money down within that, because that 5-year look back, they want to not have gifted that, they want to have spent it in that 5 years.
Pretty much. And what I would tell you to do, though, is when if there's enough assets that you're worried about that, there's 2 things to think about. Number one, I'm not a huge fan of skilled nursing and Medicaid. It's usually not the best care. And if you have the assets to avoid it, I would prefer to avoid it. Number 2, if you go to a lawyer, sometimes you can qualify earlier, pay some penalties, but save more for the inheritance than you would, and you don't have to spend all the way down to $2,000. So it makes sense to talk to a lawyer and spend the money if there are enough assets there to consider. It's one of those complicated questions. Every state is different, and giving you generalizations is a sort of a dangerous business because it's likely to be off.
We've got time for a couple more questions. I see you. I'm coming right to you.
The numbers you mentioned about Medicaid, is that for Texas or is Medicaid universal across all 50 states?
That's a good question. Medicaid is a state by state. The federal government gives every state a block grant, and then it's state run. So I gave you the numbers for Texas. They're different in every state, particularly that penalty divisor can be, varies all over the board. That's supposed to be the average price, the $237. That's supposed to be the average price for long-term care in that state. That's the way it's supposed to work. Politics get in the way. Veterans benefits are consistent across the board because that's a federal program.
And that's a good point, that if you move to another state or you have a family member that moves from another state to here, their Medicaid is not going to transfer state to state. And so they would need to reapply.
Exactly. And Texas does not want to take on Medicaid tourists, or no state does. And so they don't make it easy. There's ways that it gets done. Another one of those complicated questions that you're going to have to look into individually. But I get a lot of people saying, I want to move my mother from California. We can't afford assisted living out there anymore, and we've spent down, but we want to move her to Texas now. And, yeah, they're a little bit different. Her relatives are in a different state, and so they do look different.
I'm coming to you on the front row.
I just came from California. Did I understand you to say that I have to reapply for Medicare?
Medicaid.
Oh, okay. What about Medicare?
For Medicare, when you move, there's a 30-day period where you're allowed to re-enroll in your new Medicare here in the state. Otherwise, you have to wait until the open enrollment in the fall from October to December.
Thank you.
And I'll give a plug for one of the vendors that is here today. That is the Area Agency on Aging. And they have benefits counselors that will help you for free because they are federally funded. You've already paid for them with your tax money. And so they can help you with all of your benefits questions. We've got time for one more, and I'm going to give it to you.
My husband has two kinds of dementia and Alzheimer's and has been doing everything for 49 and a half years. And so now I'm trying to learn. And I need to go find his something or other number of when he left the military.
So there's a discharge papers, and the number you're talking about is a DD 214.
Right.
And that's the document you need and that you'll be golden for. For him, that's all you need. If it were for you, the spouse, you'd also need marriage certificate, birth certificate, and his death certificate and things like that.
But how do I get that number?
So if you call the Veterans Administration or the county Veterans Affairs officer, they can help you get. It's not a number. It's a form. It's a form number DD 214.
Okay.
Just like a 1040 for taxes, and it's his discharge papers. And then once you have his discharge papers, it'll have his service dates, whether he's honorably discharged, and things like that.
Right. Okay. Thank you so much.
And that is something also that Age of Central Texas can help with. We have a resource center, and Natalie, who is here today, can help out with a lot of those things if you're not sure where to find all of those things.
Well, I just want to comment. I just went through that as my husband recently passed away, and there's form online, and I got the DD 214 in about 2 weeks. So there's a place on there, you mark it urgent or he died or something, and you'll get it right away. So that might be interesting to know.
That's great to know about.
Yeah, and there was a fire at some St. Louis depository of the VA, and so there's sometimes for some people they can't get it, and that's been a real problem. So it's the biggest bureaucracy in the world.
We want to say thank you to Michael Gill for sharing his expertise with us today.